According to a new study, if you have to have surgery, don't do it in July. An annual report released recently warns of the July effect, referring to a supposed drop in medical care in teaching hospitals. But how real is this, and what are hospitals doing about it? Here to tell us more is ABC News contributor Dr. Chris Magovern. Dr. Magovern, thank you so much for joining us. And I might point out, there you are in your scrubs, ready to do surgery, I presume. And it is July, so clearly it's not such a bad month for some of us.
It is. We're still working. Good to hear.
So, Dr. Magovern, give us an idea of what exactly the July effect is.
Tanya, I think the first thing you have to understand is a little bit about how the medical training system works. When men and women go to medical school, they complete their schooling and they're called doctors. Your mom may call you a doctor, friends may call you a doctor, but the fact of the matter is you're probably not quite ready to independently take care of patients yet. That's the reason we have residency programs to bring these young doctors up to speed. The first year of residency is called an internship, and depending on what you specialize in, it can be 1 or 9 years for something complex like heart surgery. Now, the crazy thing about medicine is that we're on an academic calendar, and every July 1st, it's like musical chairs in this country. 100,000 doctors in training simultaneously change what they're doing. They either are medical students that become interns, or they're interns with limited experience that become residents, or they're residents that finish their training and become attendings. And that creates what we're concerned about here is what may be the perfect storm. These residents are thrown into an environment where they have more responsibility, and they're often thrown into a setting that they're uncomfortable with, a different part of the hospital or even a different hospital altogether. So that's the reason we get worried.
So it sounds a little bit like everyone is moving around at once. Has there been any thought to perhaps staggering some of this movement throughout the year?
Tanya, that's a brilliant idea, and we've given a lot of thought to that. What we would have to do is graduate students from medical school at different times of the year to do that. But that is one of the solutions that we're looking at.
What advice would you have for patients that are facing surgery in July?
Well, I think the first thing you need to realize is that this is something you have to have a little patience with. It is something that is going to happen. It's a rougher time of year. But the bottom line is you're probably better off in a hospital with residents than in a hospital without residents. And there are a number of different reasons for that. But there are some things that you as a patient can do to be your best advocate and improve your outcomes. And having said that, I think what you need to do is you need to be a little selfish, and you need to worry about yourself or your family members that are in the hospital. And there are a couple of tricks that you can do. The first thing you can do is introduce yourself to everyone that comes into your hospital room so that you know who everyone is. You also need to understand the hierarchy, understand who the medical students are, who the junior residents are, who the senior residents are, and most importantly, who the attending is, because medicine is a team sport, and the attending is the quarterback. He or she is the one that you want to be able to get a hold of if anything comes up, and you should be able to get a hold of them in the middle of the night. The other thing, Tanya, don't be afraid to speak up if you don't understand something or you don't understand why something's being done. If someone's coming in to draw your blood, why? Why is it being drawn? If you're taking a new medication, what is this? Why do I need to take it? If an x-ray was just performed, what were the results? These are the sorts of things you can do. And the last thing, perhaps, Tanya, is to have an advocate. It's better not to have to fly solo. It's nice if you can actually have someone with you, a parent, a family member, 2 sets of eyes, 2 sets of ears. So nothing gets slipped.
So would you actually then recommend people to try and reschedule their surgery if they can?
Absolutely not, Tanya. I do not think that's necessary. And the reason it's not necessary is we take this very seriously in the hospital. And there are things that we do to protect ourselves and our patients for this time of year.
Right.
We do a couple of things, particularly on the surgery service. We slow down the tempo of responsibility so the interns aren't thrown into responsible situations right away. We limit the amount of night call they take. We cover them with senior residents. We have a buddy system where they keep an eye on them. We also have a protocol where the nurses, if they need to engage or ask a junior question, they will simultaneously call a senior resident, sort of like a blind CC on your email to keep someone else in the loop. We also hold short, brief seminars for the junior residents this time of year to prepare them for the kind of scenarios that they need to deal with. So I think we're quite prepared.
Absolutely. All right. Well, thank you so much, Dr. Magovern, for explaining the July effect and giving us some tips on how to get through it safely. Enjoy your July. And for more information on this topic and others, log on to the health page at abcnews.com for the latest health news.